It's really nice to see that this day and age, I'm not trying to flatter Dentsply, but it's really nice to see how Dentsply has been able to master things so nicely, and thanks to good engineering and materials, simplify this technique. This is how things should be. If something takes a lot of steps, then not that good. If you can achieve the same or better with fewer steps, everyone's life is easier and there's less room for error. So, a few points I just want to highlight. I really want to make your life easier. So I've already mentioned this, but if you don't mind, I'm going to highlight this again because I love this feature of the GuttaCore. So once this GuttaCore comes out of the oven, remove the handle and use cotton pliers. Okay, really simple. And right here, I'm looking at the markers that are built into the GuttaCore. And break it off, really simple. It's very simple to do, and then you're putting it into the tooth. The reason why I like to do this is because removing the handle, first of all, gives you better maneuverability. Imagine putting in a paper point into a posterior especially, premolar, molar, and using your fingers to try and fit that paper point in the canals. It'll never happen. This is why I use cotton pliers. Same thing over here. Once you actually break off the handle and use cotton pliers, now your visibility into the pulp chamber, into the canals is so much better. And on top of that, it's just so much easier to do everything. So your visibility is easier, your handling of the obturator is so much easier. So just please make your life simple and just break off that handle. It's a phenomenal feature of this obturation system because not all carrier-based systems on the market allow you to do this, okay? And this is a huge, huge plus clinically. So remember, when it comes to this, break off the handle. Why does it come in handy? Because look over here. For me to do, in this case, an upper molar where the patient can't open their mouth that much, look at how easy it is for me to fit that carrier into the tooth. The opposing arch, as close as it is really not in the way. Not every patient can open their mouth like a hippopotamus and make our lives easier to obturate. This is reality here. And it'd be unfortunate if you won't be able to do the endo only because the patient can't open enough to obturate. You've done everything else, but you can't obturate enough. You say, that's it, I've done everything and I can't finish this case. On they go. Well, no, this is to make your life easier, for you to be able to complete the case. So the other tip that I like to give is with the rubber stopper. Feel free to use a rubber stopper as you wish. Feel free to use it like you do on a file to mark your length. For me personally, I don't even want to use the rubber stopper. It's there, great. It's an option for you to use. The reason is because you've got these built-in markers. So I don't even use the rubber stopper. To me, it's almost as if it's one more thing that's in the way visually when it comes to looking for that little orifice for the canal. So you can cut off the rubber stopper or slide it off nowadays towards the end of the gutta percha, not towards the handle, of course. So as you see in this video, you can just cut it off or just grab a cotton plier and sort of slide it off. But see over here, there's already those little built-in notches. So those 3 lines you see, the built-in ruler, those are your lengths. That's your ruler that's built in. So you can grab this rubber stopper. I always remove the rubber stopper. I don't see any need for it. It's there, great if you want to use it, but I bet you the more proficient, the more comfortable you become in using this, and that'll be very quick, the less you'll need the rubber stopper, which makes it even easier to obturate and makes you realize even more how much of a small little item you have as an obturator to put into that canal. It only makes your life easier. So you could use a rubber stopper or not, but remember, never use a ruler. Use the built-in ruler that's in every carrier. The other little clinical tip, if you wish, it sort of has to do with a question I often get, which is, Manor, what do I do if there's 2 canals that are really close to one another, an MB1, MB2, or 2 mesial canals as you see over here? I'm worried that if I obturate one, then the gutta percha will overflow into the other canals. That actually used to be more of an issue with the older obturators. I gotta, again, not trying to flatter them, but I gotta give Dentsply credit for listening to clinicians, wet-fingered clinicians like myself, saying, I don't like the fact you put too much gutta percha on the carrier, it's overflowing and blocking out the other canals. Well, they actually listen to frontline clinicians like you and me, and nowadays it's rarely an issue. The amount of gutta percha in every carrier is almost perfect for the average length canal. But still, if you wish, if you're worried that it may overflow, then what I recommend is using paper points to just block the adjacent canal. So if, let's say, I instrumented the canal to, say, a size 40, then I would use a paper point that's maybe a size 80, let's say. It's not going to go to the apex, but it'll just block the orifice. So use large paper points to block out the adjacent canals. Now, if you have this long paper point sticking out of the tooth, you got to imagine, well, this paper point might visually block my view into the pulp chamber. And as I put in my GuttaCore, that paper point that's sticking out of the pulp chamber is also going to be in my way physically. So what I like to do is actually cut off that paper point and make sure that the top of the paper point is below the occlusal table. So let me show you in this little video what I mean. So you see the paper point in the canal, and I'll be sort of pushing it down into the canal, not forcing it down, but just to a level where I cut it so that it'll be below the occlusal table. Now I've got a blocked canal, and visually and physically, there's practically nothing blocking me from being able to put that GuttaCore into that canal in the top part of the pulp chamber you see in this picture. So that's my little trick. I've heard other people use other things, but for me, paper point, really sweet, simple, easily available, and it's my little trick there.